Today, we live in a global community connected through the exchange and creation of content. This World Wide Web contains a number of different blogs, forums, and content communities. Twitter, Facebook, Instagram, and LinkedIn. There are so many options available to connect with others, but how does one strike a balance between their professional and social life? With about 93% of healthcare students being active users of social media, it is important to understand the standards put in place for healthcare students globally and what you should and shouldn't be doing online. Here are 4 easy steps on how to manage your social media profile. Step 1. Keep it clean. We all know how to behave during a consultation or interview, but how much of the information on your social media profile would you be comfortable discussing with your future employer or patient? Well, with a few mouse clicks, it's easy for anyone to access information online, as everything is available and difficult to remove. Once you post it out there, there's no taking it back. That being said, employers tend to search social media to screen potential job candidates and monitor their employees' presence online, so it's very important that you know what's out there. The best way to find out is to Google yourself and make sure that you're happy. But if you're not, do something about it. The internet often provides a false sense of anonymity, which can lead to the publication of unprofessional content and give rise to the question as to whether a patient's health is in capable hands. What you've liked, commented on, shared, or posted in the past can easily be found, and following inappropriate pages or posting comments of a bigoted or extreme nature are often what gets students into trouble. Excessive drinking, partying, or even illegal behavior can also be seen. Furthermore, questionable material such as challenging behavior towards clinical teachers, plagiarism, sexualized content, and commentary on sensitive topics such as employment, political affiliation, religion, and other individuals can stay online for nearly an eternity. The results of such actions may compromise your virtue as a professional and destroy any value of counseling, as you may be seen as hypocritical. With so much at stake, be careful about what you post before it comes back to haunt you. If you have had a slip of judgment and want to remove an embarrassing photo or damaging post, your best bet would be to contact the webmaster of the site. They, however, have no obligation to delete it, and therefore it is important to slow down and think carefully before posting anything. Remember, everything can be traced back to you, and even if you're conscientious of what you post online and display healthy behaviors, a great amount of personal information that you might not want known can be derived from small, insignificant things such as your location and pictures. This is why it is greatly recommended that students and professionals alike keep their professional and personal profiles separate. Creating a relationship with your patient outside of work can compromise the medical care provided if not done properly, and it is advised that a social networking relationship not be encouraged unless there is a professional networking site in place. You don't have to sacrifice freedom of expression for professionalism. Just make sure what you choose to upload will be okay for others to see. In the end, your approach to social media and the way you manage it is completely up to you. But whatever you end up choosing, remember one basic rule: keep it clean. Step 2. It's all about security. Aside from keeping a clean profile, it is important that you have the appropriate privacy settings set up to a level that you're comfortable with. With today's social networking sites, you can choose from a list of options for who can and cannot view your profile. A British medical journal study shows that 25% of doctors do not use privacy settings, despite the fact that they're becoming more flexible to adapt to their needs. The misconceptions with these settings are that they can lead individuals into having a false sense of security. Take Twitter, for example. If someone were to retweet your photos or messages and you make your account private afterwards, these retweets will still remain public. In that sense, others will still be able to retrace your social media profile in the future. If what you have tweeted is not a positive representation of yourself, you may lose the trust of your patients and perhaps even your colleagues at work. Furthermore, screenshots can be taken of just about anything. So be sure to take the conservative approach when posting content anywhere on the internet, as there's no guarantee of privacy. While privacy settings are beneficial and can deter most individuals from prying, they only make it more difficult to access online information and are not foolproof. Anything you upload onto cyberspace can still be found, and nobody wants to be on the negative end of that situation. Truth is, nobody has to be. If you understand the function of privacy settings on social networking sites and are clear on who can view your profile, then one can maintain a positive online reputation as a healthcare student or professional with little effort. Step 3. Maintain the public's trust. The relationship between a healthcare professional and their patient is built on a mutual respect and the preservation of confidentiality. As a future healthcare professional, do not release any information about a patient or post anything that is related to their care without documented consent, as it may have severe consequences. Expulsion from your program is truly the least of your worries, as other consequences may include getting your license revoked, legal issues, and incarceration. Even information that is unidentifiable can equate to a confidentiality breach, as it can be pieced together. Refrain from any posts about patients, and don't discuss your patient online with another individual that isn't part of their immediate care. If you are seeking a professional opinion online, keep in mind that they are not directly involved in the care, and therefore you have no right to disclose specifics. You can, however, speak of the case in a very general context. If you're not sure if you can share a certain piece of information or even an image, then just don't do it. This way, the patient's confidentiality is maintained and a sense of mutual respect remains present. Step number 4. If you provide advice and your opinion, do it properly. Social media is actually an incredibly useful tool in establishing global networks, facilitating patient access to services, and providing thoughtful public health and policy discussions. Today, people with chronic conditions can seek out information through online resources and speak to individuals in similar situations, allowing them to take a more active role in healthcare decisions. As a student, you may be on the receiving end of some of these inquiries from friends, family, or even the general public seeking advice. Many are under the misconception that as a professional in training, you're qualified to answer their questions. Fact of the matter is, you're really not, and you should try to avoid this type of communication as much as possible. If you choose to partake in online discussions, here's some simple advice on how to keep yourself in the clear legally and ethically. When online, make sure you identify yourself authentically to the public. Be upfront with who you are and what qualifications you have so you're not misrepresenting yourself as an experienced veteran. Always provide accurate, up-to-date, factual information which is clinically proven. Providing individuals with resources to find the information themselves is often a great choice. Also, don't exploit the public's vulnerability or lack of medical knowledge, but rather try explaining things in the clearest and simplest terms, and provide different viewpoints on a topic or opinion. In response to specific electronic inquiries, try not to refer to the sender, but rather all replies should be written in a standard form response in order to avoid crossing the line of confidentiality. If that person happens to be someone you see on a regular basis or a patient, written and informed consent is a necessity before beginning any online interaction. When online, it's all about branding and putting your best foot forward when discussing professional matters in a public context. If you choose to engage in these online communities, make sure to protect yourself and have the best interests of your patients at hand. Although keeping track of your social media seems easy, it's really not. A U.S. research study into medical students' use of social media indicates that cases which resulted in rustication were primarily caused by patient confidentiality violations, use of discriminatory or profane language, and depictions of intoxication or illicit substance abuse. In fact, the chair of the General Medical Council told student BMJ that there are approximately 350 to 400 concerns about student conduct per year, with 60 resulting in the student's fitness to practice being called into question. In the past couple of years alone, there have been several headlines gracing newspapers in regards to misconduct amongst healthcare students in training and professionals alike, from uproar after doctor takes selfie next to woman giving birth in hospital, to hospice nurse guilty of misconduct after inappropriate Facebook postings, to another Uber fight, doctor placed on leave after video meltdown. In most of these situations, individuals have been put on administrative leave and removed of their duties. This is why, in order to protect yourself and your patients, it is incredibly important to separate your professional and personal life, keep your profile clean and clear from questionable content, keep your security settings up to date, and interact with patients properly. As current social media standards change as society evolves, it is your responsibility as a healthcare student to keep up to date on standards expected from your regulatory bodies in your field of study. What you do is up to you, but try to use sound judgment and stay professional, especially when social media is so easily accessible. Everyone has some sort of recording device nowadays, so you never know who could be watching.